So today's review is going to be the skull. It's the bones that make up the skull and its associated bony landmarks. There's 55 that we will cover. So there's 22 bones of the skull, 8 cranial, and 14 facial. So I will explain that on this skull model. So this is Jeff. This is going to be our skull model for today's review. So we're going to cover 55 bony landmarks and yeah. So let's review some of the key aspects of the skull. So the skull is made up of 22 bones. So there's 8 cranial bones that basically makes up the cranium, the skull aspect. So basically, what is the cranial bones? So they're basically enclose the brain in the cranial cavity. There's the cranial vault, the skull cap, the calvera space that basically protects the brain. That basically is a space that protects the brain with the base of the skull. So again, the cranial vault is basically the space that protects the brain with the base of the skull. So the cranial base is obviously you have the anterior, middle, posterior cranial fossas. I will show that on Jeff the model. So Jeff the model will go inside the cranium aspect, show you the anterior, middle, and posterior. So this basically provides attachment for the head and neck muscles. So let's go into the 8 cranial bones. So right at the anterior aspect, we're going to start off with the frontal bone. So this is labeled by 1 right over here. So this is the frontal bone. And then at the 2 sides, we have the 2 parietal bones. So one here, one here. So there's 2 parietal bones. And then right off to the side, right this area, you would see that this is the temporal bone. So right here, you're going to have the temporal bone. So there's 2 of them, so right and left. Right. So you can see that that's labeled by 4. So temporal bones. So and then you have the occipital bones right at the back, right over here. Okay. So basically, there's 6 bones on the anterior superficial aspect. So you have the, again to review, the frontal bone right over here, the 2 parietal bones right at the superior aspect, a little bit inferior, labeled by 4. You're gonna have your temporal bone at the back. You're gonna have your occipital bone. So let's open up the cranium. So inside, you're gonna see the 2 remaining bones. So right over here, you're gonna see that right here, this aspect right over here is going to be the ethmoid bone. So ethmoid bone is going to be right over here, ethmoid bone. And then right here, this notch, you're gonna see that this is the crista galli of the ethmoid bone. And then if you go right over here, you're gonna see some sort of rings. This is labeled by 6. This is going to be the sphenoid bone. So this entire region is going to be the sphenoid bone. So 5, you can see right over here, this entire region is going to be your ethmoid bone. This entire region is going to be your sphenoid bone. This entire large region looks like a bat, so that's going to be your sphenoid bone. So by 5, you can see a label. This is going to be your ethmoid bone. 6 is going to be your sphenoid bone. So these are the 8 bones that make up the cranium. So the cranial bones, 8. Right. So now we're going to discuss the 14 facial bones. So the facial bones, these make up the framework of the face. They have cavities for your special sense organs such as your sight, taste, and smell. They basically allow openings for your air and food passages. There's also they serve as an attachment site for your teeth. and the muscles of the face and your facial expressions. So we're going to go back to Jeff, and we will explain the facial bones. Okay, so the facial bones, we're going to start off with the single bones. So the single bones are going to be your mandible. So this is also known as the jaw. So mandible right here. So that's another single bone. So there's 14 facial bones. And then right inside here, this nostril type of area, this is going to be your vomer bone. It's labeled by 11. This will be your vomer bone right over here. So these are your single bones. So you have the mandible and vomer that are single bones. The rest are going to be in pairs. So you have your two nasal bones at the top. So two nasal bones right over here, two nasal bones, and then you have your two right here. If I show you, you have your two. So just to show you, by number 9, you can see this is going to be your lacrimal bone. This is where your tears are secreted. So tears are secreted right over here. So two lacrimal bones. So what do we have? We have 2, and then 4, 6, right? And then you have your 2 maxillar bones right over here. So right and left. So this is 8. Is labeled by your maxillar bone. So maxilla bone. So there's right and left. So that is 2, 4, 6, 8. And then you have your cheekbone. This is also known as your zygomatic bone. This is labeled by 10. So that makes 10 bones then. And then you have your 2 inferior nasal concas. So these are basically inside. I can try to show you. So they're basically right here. So they're your inside bones right here. So these are the 2 inferior nasal concas. So that's 12 bones in total. And then we're going to go inside a little bit. So right over here, labeled by 13, this is going to be your palatine bone. So palatine bone is right over here. Okay, so that's 14 bones. To review, you have the mandible, 1. You have the vomer inside, 2. You have the 2 nasal bones, the 2 lacrimal bones. So that's 4, 6, and then the maxillar bones, 8. The cheekbone, zygomatic bone, right? And then that's 10. And then you have your 2 inferior nasal concas right over here. And then the last 2 facial bones, no particular order, is going to be your palatine bones. So right over here, 1, 2. So right and left. Remember that. So next we're going to look at the sutures of the skull. So there's 3 main sutures. So just to remember the 3 main sutures. Sutures are basically what connects the bones, the cranial bones together. So this is going to be right at the top here, this line here. It's going to be your coronal suture. Sorry, coronal suture. So coronal basically also represents that it can cut the it basically cuts it into anterior and posterior aspect. So this is going to be your coronal suture. Right in the middle right here, you're going to see this is 15. So 14 was your coronal sutures, 15 right here, that splits it into right and left. This is going to be your sagittal suture, splits the body into right and left. These are basically connecting the 2 parietal bones together. And then this new suture you're going to see right at the back here, this is your lambdoid suture. So this is labeled as 16. So what is the lambdoid suture? So lambdoid sutures, the anatomical definition is that it connects, it's basically a suture that basically connects the 2 parietal bones and the occipital bone, and then the suture around it. So this is what we call the suture. is basically the connection between the two parietal bone and the occipital bone, rhomboid suture, right? Okay. Moving forwards to the back, right here, you're gonna see that this there's a protrusion outwards. So this is going to be your external occipital protuberance. You can actually feel that at the back of your skull. Okay, and then we're gonna go into the big hole right over here. This is known as the foramen magnum. Foramen magnum basically allows the spinal cord to go through it. Basically connects into your cerebrum, your brain. All right, and then right over here you have these kind of like smooth edges. This is going to be your occipital condyles. So your occipital condyles basically articulates with the vertebras. Okay, and then we're going to go into this is very difficult to show, but you can see that 20 right over here, so 20 right here. So this is going to be your jugular foramen. So 20 right here, jugular foramen. So that's where your jugular foramen, jugular veins are going to go through, jugular arteries. And then you have your 21. So 21 is right beside it. This is going to be your carotid canal for external opening. So carotid canal for your carotid arteries. So right over here is going to be your carotid canal for external opening. Okay, and then you have this. This is my favorite kind of bone, you can say, of the skull, is this very pointy aspect. So this pointy protrusion outwards. So you can kind of see. So this pointy bone right over here, this is known as your styloid process. Okay, so styloid process right over here, and then you're gonna have the mastroid process right behind the ear. So mastroid process. So this is going to be your 22, 23 mastroid process. In between, what would it be? It would be the your stylomastoid foramen. So you have your styloid process, mastoid process. In between is going to be your styloid mastoid foramen. Okay, and then right over here, you're gonna see, you can kind of see the opening right over here, also labeled as 25. You can see this opening. This is actually known as your external acoustic meatus. So external acoustic meatus, also known as your external auditory meatus. So this is basically the entrance for your ear canal. And then this is going to have 3 more bones that you're going to find in here. That's basically, it's going to be your malleus, incus, stapes. Malleus being the most external, incus and then stapes being the most internal. Middle is going to be your incus. So the most external bone is going to be your malleus, and then most internal bone is going to be your stapes. So that's basically what you're going to find inside the external acoustic meatus. Okay, and then we're gonna go into you're right over here, right between the jaw or your mandible. You're gonna see that this is going to be your mandibular fossa. So mandibular fossa right over here. It's kind of right between this rubber. So 26 is going to be your mandibular fossa. Okay, and then you're gonna see that there's another landmark right over here. This is 27, right? You can kind of see this. This is going to be the zygomatic articular tubercle. So zygomatic articular tubercle right over here. You can see it's going to be labeled by 28. This is the zygomatic arch. Okay, and then right around the zygomatic arch, you have this H type of suture or H looking structure. This is going to be the pterion. So right here you can see it's labeled as 29. This is the pterion. All right. So moving forwards towards the anterior of the face, you have your supraorbital
supraorbital notch. So supraorbital notch is also going to be followed by the infrasuperorbital feature notch, right? So that's 35 right here. So supraorbital notch, and then you're gonna have your I'm gonna try to show you this if I can find it. Yeah, so internally you see 31. This is going to be obviously right here. It's going to be your superior orbital feature, and then right below it, it's going to be your inferior orbital feature. So right, inferior orbital feature, superior orbital feature, and then right over here, you're going to see 33. This is also the optic canal. Optic canal is going to be followed by your right over here. This is where I said earlier this was your lacrimal bone. This is also going to hold the fossa for the lacrimal sac. So lacrimal bone holds the fossa or also has the fossa for the lacrimal sac. So lacrimal bone also has a fossa for the lacrimal sac, which basically produces your tears. And then to repeat, 35 is your infraorbital feature, infraorbital notch. And then we're gonna go towards the inferior aspect right over here. You're gonna see is your, if I can show you, so 36, you can see that. So 36 is gonna be your incisive foramina. So incisive foramina. So what is the incisive foramina? This is an old terminology. It's actually known as the maxilla hard palate. So just remember, this is the maxilla hard palate, also known as the incisive foramina. Okay, so let's just go right into this. So again, you have your palatine bones right over here, labeled by, so it's labeled by 13 right here. So right beside the inferior, so palatine bone, you have your at the top, at the top right here, this is labeled by your 37. So it's labeled by 37. This is going to be your greater palatine foramen. So let's try to zoom in on this, kind of see this better. So 37 is going to be your greater palatine foramen, and then right below it is going to be what? It's going to be your lesser palatine foramina. Okay, and let's go now more. We're going to open the skull now up. We kind of covered majority of the facial aspect. So opening the skull, we're going to go into, we're going to show you, let's just kind of reduce. Yeah, so you can see we're going to go through the fossas, like I said earlier, of the cranium. You have your 39. You can see it's going to be your anterior cranial fossa. Okay, and then right over here you can see 42. So right over here you can see that 42 is going to be your middle cranial fossa, and then right over here, right at the back, 48, this is going to be your posterior cranial fossa. So middle cranial fossa, posterior cranial fossa, and then you have right over here anterior cranial fossa. Again, anterior of the skull, posterior of the skull. So obviously you're gonna have the posterior cranial fossa at the back. Okay, so let's just repeat. This again, this protrusion outwards, this is going to be the crista galli of the ethmoid bone. So let's just kind of give you a better look. Okay, so crista, so 40, it's kind of labeled 40 right over here, is the crista galli of the ethmoid bone. 5 again is the ethmoid bone, anterior cranial fossa, and then you have your basically your 41. This is going to be the lesser wing so the lesser wing of the sphenoid bone. And now you'll be asking, where's the greater wing? Greater wing is basically right at the outside here. So greater wing of the sphenoid bone. This is the lesser wing of the sphenoid bone. Okay, and then you have your middle cranial fossa, 42. 43 is a very important structure, so make sure you know this area, very important. This is known as the hypophyseal fossa. So hypophyseal fossa is the old term. The newer term is your sellar truncatus. Sellar truncatus basically holds and protects your pituitary gland. Pituitary gland, again, you know this, it's gonna secrete your hormones, right? And then let's move into your these structures right over here. So you have, let's see if I can even kind of show this. So 44 right over here is going to be your foramen rotundum. 44 is going to be your foramen rotundum, and then 45 right here, the hole, is going to be foramen valve, and then 46 is going to be your foramen spinosum right here. Foramen spinosum. 44 foramen rotundum, and then 45 the hole, foramen valve. 46 is going to be your foramen spinosum, and then you have your, you can see that 47 not really well labeled. 47, this is going to be your foramen for the lacrymum, again producing the tears. Okay, and then we're going to show again, this is going to be the posterior. So right here, the back, you can see that this is the posterior fossa, 48. Posterior fossa. Okay, and then I'm gonna try to show you a very important structure right here. There's two of them, obviously. This is kind of not that well labeled, but 49, this is going to be this kind of line here. You can see that this is going to be your internal acoustic opening for your ears, and then the ear bones also come in internally in here. So your, what is this again? To repeat, is the internal acoustic opening. And then you have basically your hypoglossal canal. Where's the hypoglossal canal? So hypoglossal canal is going to basically be in between here. Is this entire structure. So your hypoglossal, this is labeled as 50. Your hypoglossal canal right over here. Hypoglossal canal. This is basically going to house the hypoglossal nerve. This is the cranial nerve 12. The main function of the cranial nerve is that it basically innervates your tongue. Okay, and then we're going to go back into the front. I'll show you that again. We know this is the mandible, right? So we're going to focus more on the mandible now. So you're going to have your coronoid process. So coronoid process right over here, 52, you can see that. And then you have your right here, you're gonna have your condylar process. So you have your coronoid process, then you have your condylar process, and then right at the anterior aspect you have your you're gonna see that these holes, okay, you can't really see, so these holes, this is your metal foramen of the mandible. So there's two of them right here. Let's try to zoom in on that. So metal foramen of the mandible, and then inside, one last time, right here, you're gonna see some sort of cavity right over here. This is gonna be your mandibular foramen. So this kind of hole type of here. This is labeled as 55. See if I can get it right here. This is known as your mandibular foramen. So these are the 55 structures of the skull that we have covered. So do review, and we'll go through the muscles next of the cranium of the skull. So what muscles are attaching to it. So there's about 48 muscles we'll cover right on this skull. Jeff was a really good help today. So just review that. Also review your slides. And yeah, good luck.